Hello everybody, Capital 3 Sonography with our series Draw With Me, the spleen protocol. This video will cover the two basic images needed to image the spleen in a basic ultrasound protocol, as well as looking at how to measure and some other tips and tricks. When we get started with imaging the spleen, we are going to find the long spleen first. Now the long spleen is typically taken from the coronal view in between the rib spaces. So this sets up our picture a little bit differently than we are used to. So if this is the coronal view, then we have lateral at the top of our picture, with medial being more into the deep part of our picture. We then have superior on this side and inferior on this side. So we want to make sure that we can clearly see the inferior pole and the superior pole and visualize the hilum so we can get a nice measurement of the spleen. Now we can see a lot of the splenic parenchyma in this image. We can also see the diaphragm on the superior side, and then superior to the diaphragm we have the pleural space. Drawing this picture then, we are going to start with drawing the spleen. Again, it kind of takes on kind of a half moon, kind of a triangular shape. We can see the diaphragm as a bright echogenic line on the superior side. And then we can see the pleural space superior to the diaphragm. This is a great view for checking for fluid in the thorax, also known as a pleural effusion. In this image, we can see a lot of bowel in the area, as this is where the large intestines turn as they descend on the left side. And for many patients, we actually can see the left kidney in its long plane as well. So I commonly use the spleen as a window to look at that left kidney, or use the left kidney to be able to find the long spleen. Labeling the picture, this is the long spleen image. So we have our long spleen. We also have our diaphragm. The pleural space. Bowel, and the left kidney. Now it's important to note that the spleen is a similar echotexture and echogenicity to the liver. So we are able again to compare the spleen and its echogenicity to the left kidney. To measure the spleen then, we want to take a caliper and place it on the inferior pole as far down as we can see. And then we are going to imagine our line connecting back to the superior pole. Now it's important that we don't measure too far out of the hilum, so we are getting an inaccurate measurement. Moving to transverse spleen then, we are going to turn our transducer 90 degrees from where we found our long spleen image, and we are going to take a picture of the spleen in transverse. Again, we are most likely in the coronal plane. So again, we have lateral and medial, but now we have anterior and posterior in our image. Getting ready to draw this picture again, the spleen takes on more of that triangular shape to it. The way that you will hold your transducer over the rib spaces does oftentimes cause some rib shadow. So we might see some rib shadow along the border. We might see it through the middle, just depending on where the anatomy of the spleen lies underneath the ribs. We can also see the diaphragm on the posterior portion as it wraps around. And again, we'll see bowel in this area. If the left kidney is present, we should be able to double check that to a transverse left kidney. It should match up with our transverse spleen image. Labeling, we have the transverse spleen, which looks very similar to our long spleen, but this is a different plane because we know we turned that 90 degrees. Oftentimes you will have rib shadow. This may require you to take more than one picture if you can't get all of the transverse spleen seen with one image. We'll see the diaphragm more on the posterior side of the spleen. There's commonly bowel in this area, which is why we like to use the rib spaces as a window. And the left kidney is often seen in this image as well. And that's really it for imaging the spleen. So let's get into some tips and tricks, as the spleen can kind of be a tricky organ to image. So number one, make sure you are breathing your patient. The spleen sits right underneath the diaphragm. And we know as a patient takes a breath in, it moves the organs down about a centimeter or so. And that slight movement can actually give us a brand new window to the organ and be the perfect spot to image. But the spleen can sometimes be a little tricky. You can see in the picture here, again, the spleen is right next to the diaphragm, and then we have the lung sitting right above that. The left lobe of the lung quite often kind of, what I say, plops over the spleen. And because we're not very good at imaging through air, we actually get kind of a lot of artifact kind of hiding that spleen. So sometimes a breath in all the way actually just overinflates the lungs and totally obscures the spleen. So you need to be patient and see what their normal breathing does. Maybe just that tiny little bit of normal breathing in will move the spleen into a good window. Maybe you'll watch as they exhale. Maybe the spleen moves into a good spot then. So you want to kind of watch how their normal breathing affects how you can see the spleen. Definitely try a breath in all the way. And sometimes you can have them take a big breath in and then blow it all out and have them hold that exhale. That'll keep the lung deflated and hopefully give you a nice window to the spleen as well. So make sure you're trying different breathing techniques. As with most of the organs, always try your multiple windows. For the most part, you are going to have your patient rolled into the RLD position, the right lateral decubitus position. If you have them rolled, that gives you actually a lot of access to not only use the anterior window, to use the coronal plane, or even more of a posterior approach. So really make sure that you're trying all of your windows. You'll find quite often the window that worked for your kidney is going to be a similar window for your spleen. My third tip then is to utilize the intercostal space. So you align your transducer within the intercostal space to get that long image. That way you aren't really getting shadows from the ribs because you're right in between the rib space. And that actually gives you usually a very nice image of the spleen in long. And then when you're ready to go to transverse, you're going to turn your probe 90 degrees. If you have to use a second hand beginning, go ahead and do that. If you have to look at your probe to watch yourself turn 90 degrees, go ahead and do that. But when you turn 90 degrees, part of your probe is most likely going to be residing over a rib. And we know we're not very good at seeing through ribs. We are going to see some shadows in our image. The goal, though, is to maybe breathe the patient or just manipulate the transducer just so maybe we can get one of those rib shadows just off to the side, or we might have to take an extra picture to really show the spleen in transverse in its entirety. Remember that the spleen works as a great window to the kidney. So you can use your kidney, if you're really good at finding the left kidney, you can use the kidney to double check where your spleen is, or if you always seem to happen to find the spleen, then use your spleen to find where the kidney is. When you are in long on the spleen, you should be able to angle down towards the patient's feet or move down a rib space and see a long kidney. If you're in true transverse on the spleen, you should be, again, angle down towards the feet, and you should be able to see the kidney in transverse. And my last tip is about how to measure the spleen. We're going to measure from the inferior pole to the superior pole, trying to stay mostly within the splenic tissue and not going through the hilum as much. So in our example here, again, we're going to go from the inferior pole to the superior pole. So in this image here, if you have a very curvy spleen, you want to make sure that you're measuring from your inferior pole and then using kind of an imaginary line, or if your dots do come up on your measurements, then you can align those right along the hilum of the spleen, coming back to the superior border. So the green line here is a very nice measurement. The yellow line is just slightly outside, and that's actually okay too. We just don't want to get excessively outside of the spleen, as this red line demonstrates. This middle spleen is not very curvy, so it's actually very easy then to measure from inferior to superior pole. And then if you have a mild curve, again, trying to keep as close to the hilum as possible to get an accurate measurement will be important. Remember too then that the normal adult spleen should measure less than 13 centimeters. And that is it for our spleen protocol. So I hope all the drawings and tips and tricks help you to become an expert at imaging the spleen with ultrasound.